Since we made the presentation of our presenters last week, I'll just kind of review the course. It's the abortion issue. It's a particularly difficult and sensitive one. People care about it deeply and for different reasons, though at times for surprisingly symmetrical ones. Philosophers Jack Mulder Jr. and Bertha Manninen, who are on opposite sides of the debate and wrote a book about it, will offer the reason for their respective reviews and suggest that there is space for common convictions outside the abortion debate. And this is the book they wrote. And I'm reading it, and it's very good. So, Jack, Bertha, take it over. Arizona.
Yeah, Bertha, you're in Phoenix, right? Right now?
Yes,
Yeah.
yes.
Yep. Yeah. It's
Do you want to start since you're there?
What's that, Bertha?
Do you want to start since you're there in person?
I'm happy to start whatever you think. Yeah, I mean, I was just going to give us a quick kind of reorientation to the session, and then I mean, if you want me to go first, I can do that. It's no problem. Otherwise, you're welcome to. What would you prefer this time?
I mean, I figure since you're there, you're probably better to start first.
Okay, well, I'll give it a try. You'll find if I have to go first, you'll find that like a lot of times we anticipate each other's arguments and objections a lot, and that's probably because I mean the truth is my own thinking about the abortion issue is probably not really separable from my friendship with Bertha, right? I mean, like we've talked about this many times. We've talked about it at a lot of length, and although we both utilize the scholarly conversation, we and have our own ways of doing that. Nevertheless, I think I owe a lot to the kinds of questions that she brings up and the kinds of things that I think would be important to tackle in a treatment of the abortion issue. But anyway, so here's our second session. The first session we talked more. Is everybody hearing me okay? Is that right? Doing okay? All right, please just shoot your hand up if for some reason my mic is off or I not speaking into it enough or anything like that. But so last time we focused more on what we were calling the personhood questions, right? We were focusing a little bit more on kind of questions about whether the fetus constitutes a person, right? And if fetus constitutes a person, then, and remember, I'm using fetus as kind of shorthand for conceptus, embryo, fetus, at any stage of development, basically. So yeah, last time we were talking about personhood and what would happen if we took the view that the fetus were a person and what difference that might make. Today, we're going to talk a little bit more about a different kind of question related to the abortion issue. And sometimes I was telling folks as we kind of exited last time that I think we'll probably get to some more of what we might call our real disagreements here, just because, I don't know, I mean, I guess we disagree about the personhood issue on certain things, of course, but we also have some different ways to approach some of these cases, especially where it concerns autonomy and the way a society ought to be structured and things like that. So yeah, so we might find that we disagree about some of those things, but we also, and I think this is kind of unique toward the end of our time here today, we wrote at the end of that book that Mark was showing you, we had a chapter called Convergences and Divergences. And in that chapter, we focused on issues of kind of social justice, sexual ethics, and issues having to do with contraception, where we kind of have some agreement about social justice. We can find a little bit of agreement about sexual ethics, and we can find a little less agreement about contraception, but we can still find room for dialogue on those things. So yeah, we were trying to show that despite our disagreement on the abortion issue, we could still find healthy ways to talk with one another about related but not identical issues. So anyway, Bertha, it sounded like you wanted me to start, so I'll just say a few things about why I take the position I take where it concerns some of these autonomy issues, or you're welcome to do it from here, whichever you'd prefer. But I kind of was getting the hint that maybe you wanted me to start this time, so I guess I'll do that. All right, so if we're focusing on some things having to do with kind of you know, autonomy, what you can do, right, in a medical context, what kinds of liberties a patient might you know, avail themselves of, or something like that. There's a few things I want to talk about here. One is that I would ask you to keep in mind that for the most part, I think it's best in the context of the abortion debate, and certainly the dialogue Bertha and I are having, to focus on premises and arguments that don't spring from a particular religious tradition, right? That's not because they're wrong. It's not because those arguments don't hold important weight. And it's not because I think that every kind of religious conviction should be tossed out of the public square. I don't think that either, right? But I do think that for the most part, in a pluralistic society like the United States and most modern Western democracies, you know, it generally is, for the most part, unnecessary and usually strategically unhelpful, right, to make arguments for controversial premises that are divisive across various religious bodies using the arguments of one particular religious tradition. I usually think that's usually not going to carry the day, right? Again, that's not because I think that those things are bad or irrelevant or you know, should be tossed out of the public square. There are cases where I think religion has a role, but I don't think that it's usually the best way to talk about kind of divisive issues, right? But this particular kind of thing that we want to talk about today is interesting because even if, right, and this is connected to an argument that Bertha often refers to by Judith Jarvis Thompson, where Thompson claimed that even if, right, the fetus were a person, which is a view that Thompson did not hold, right, but even if the fetus were a person, she still thinks that abortion should be a right because the fetus's right to life doesn't extend so far as to kind of intrude upon, right, you know, the mother's, you know, the mother's right to her own bodily autonomy, right? And that's something that I want to talk about a little bit today. You know, I don't think I'm going to go too far into Thompson's arguments just because there are a lot of twists and turns and a lot of weird analogies. But the case that Bertha will often reference, which is an actual case in U.S. case law, is McFall v. Shimp, right? I can't remember exactly when McFall was. I don't. You remember when McFall was, Bertha?
I think it was 74.
Okay. Yeah, so McFall v. Shimp, you know, long ago kind of case in U.S. case law. Shimp was, I think, the cousin or something like this, some kind of not terribly near biological relative of McFall, and McFall needed a bone marrow transplant, right? And McFall turned to Shimp. And Shimp, owing to the painful, right, extraction of bone marrow, Shimp didn't want to undergo that extraction, right? And McFall was going to die, right? And ultimately, McFall did die as a result of not obtaining the bone marrow that he needed, as I understand it.
Yeah.
Yeah, yeah, and so you know, Bertha will often kind of make reference to this case. And I think it's an important case to think about because it has an important analogy to kind of the abortion case, right? You know, what Bertha, you know, and I don't want to jump the gun here, but what I would, the judge in McFall v. Shimp ended up saying that Shimp had it within his rights to not donate bone marrow, right? He couldn't be forced to donate this bone marrow, even if McFall were to die as a result. And you know, that's sort of a similar kind of idea here in that you know, Thompson, for example, will say that the fetus doesn't have a claim upon the woman, the mother, that the mother would supply, must supply, right? This kind of life-sustaining, right, aid in gestation, right? The fetus doesn't have that right against the mother, right? In a kind of public and legal sense. And so yeah, that claim is an interesting one because Bertha and I are going to disagree about that. I think that abortion ultimately is a particular assault on the fetus's autonomy, right? It's an interesting discussion about autonomy here, but I also think that that abortion tends to be a discrete, particular, intervention, right, against the fetus's autonomy. So I don't think that it's true that even if the fetus were a person, right, we could just talk about the fetus not having the right against the mother. Also, as Bertha and I are probably going to get into a little bit as we go along here, ultimately, I'm not persuaded that society should be as hands-off as the judge sort of suggested in McFall. I do think that it would be too much to, as Bertha says elsewhere, strap Shimp down and extract his bone marrow forcibly. But that's not the same as kind of regarding Shimp's abstention as with indifference. I don't think the law should regard Shimp's abstention with indifference when he's the only reasonable person who can help, right? And I'm not persuaded that that's the kind of thing that the law should just kind of remain silent about. And so Thompson, for example, this earlier defender of abortion rights from which Bertha will draw some inspiration, sometimes says that it would be frightfully nice were the equivalent of Shimp to donate his bone marrow to McFall, and it'd be a good thing. And the judge even said it was morally bad for Shimp to not donate his bone marrow, but the judge said you can't force it. Okay. And yet I think that it's a little more complicated than that. I think that while I think we can say you shouldn't strap him down and forcibly extract his bone marrow, on the other hand, the law shouldn't just be indifferent to it either. I think we could talk about what are ways that Shimp could end up kind of criminally callous here, especially if he's the only relevant person who can offer that aid. And because I take that position, I also think that it's relevant that we could expect, the woman to offer life-sustaining aid in the right sorts of circumstances for the fetus, especially as I think is important too when that relationship is already established in pregnancy, right? The interesting thing about the McFall v. Shimp case is that the relationship is not exactly established in the same way, right? It's a question of whether Shimp wants to have bone marrow extracted, right? And to come into that relationship, right, in some important ways. Whereas in pregnancy, I think that relationship of dependency is already established. The last thing I want to say before I hand it over to Bertha, and I'm sorry I've been talking for so long, is that one thing that I want to say that should govern everything else that we're talking about today is that I just do think that we can talk about analogies and metaphors, but I think that human pregnancy and really just mammalian pregnancy is completely unique as a state, right? It's just like we can talk about parallels and things like that, but ultimately it's just very, very unique. And we just need to have a good deal of respect for the idea that this is a relationship that's very unique and it's hard to say a lot about it without, it's hard to make a lot of parallels because it's just a very unique relationship. Okay, anyway, I'm done for now, Bertha. Feel free to talk a little bit about your view. I think what we were going to do then, if you need a prompt, is just that we were going to turn to kind of why you're pro-choice with particular emphasis on kind of these autonomy and politically related worries. Is that okay?
Yeah, sure. Yeah. Um, yeah, so Jack already summarized uh part of the argument. So the argument that Thompson makes in her article is that um having a right to life, so even if we give the fetus a right to life, having a right to life does not mean that you have a right to anything that you need for survival, right? And that you especially don't have that right when it conflicts with someone else's right. In this case, the right to their bodily autonomy, right? Um, and I actually think that McFall versus Shimp is, I mean, the closest I can see that I know of to a judicial case where this tension is there, right? Does the right to life of one person mean that another person is forced to give up their body to save their life? But I don't even think it's strong enough to make the case for abortion. And I actually think one of the things is that helps the argument is that, I mean, a bone marrow extraction is uncomfortable and painful, but that's it, right? It lasts, I don't know how long, a couple of hours. You might be some sore afterwards. There's no life, there's no threat to your life or anything of the sort, right? So we're saying that we can't force someone to undergo a painful procedure to save someone else's life. And if that's the case, then I think that makes a greater case for the legality of abortion because I don't think Jack is one of these people. Let me emphasize that. But I do think a lot of pro-life people um underappreciate what goes into a pregnancy and what results are from those pregnancies. I see this a lot in my students, right? They'll say things like, well, the mother only has to be pregnant for 9 months and then she just has the baby and she can give it up for adoption, right? Like the baby is renting out a room in her house or something like that. But that's just not true. Um, I think the United States currently has the highest maternal mortality rate in all of the rich countries. Not I mean that's not, not most women don't die, but many women have very severe and permanent health issues even in a very healthy pregnancy, right? The ones that you hear the most are, like, for example, like gestational diabetes. I had gestational diabetes with my second pregnancy, right? And I think a lot of people think, oh, you get diabetes during the pregnancy, you might have to do some things, but when the baby's born you go back to normal. That's not true, right? People with gestational diabetes have a permanent elevated possibility of having type 2 diabetes. And some people even turn to type 1. There are some women whose pancreases just never go back to producing insulin after gestational diabetes. Um, you have all sorts of things. Women have almost bled to death because of bad pregnancies. Women have died because of high blood pressure because of complicated pregnancies. There's I can never say it correctly, but it's the extreme morning sickness. Like, I think I don't know, I can never pronounce it correctly, but it's not just like you're throwing up in the morning, you throwing up so much that you can't sustain water and you have to be hospitalized, right? Sometimes there's bed rest. I know someone that had a perfectly healthy pregnancy, no problems at all, textbook, had a problematic delivery, and then when the baby was coming out, it shattered her pelvis and she had to relearn to walk again. And now is permanently handicapped because of it and always needs a cane, right? I think that these types of things happen more often than people think. And I don't think people appreciate how dangerous and permanently uh, harmful a pregnancy can be. It's not like renting out a room in your house. It's not like donating bone marrow where it's just painful. Um, I mean, when I donate blood, I'm told all the time, like, oh, if you feel even a little bit dizzy, you can stop, right? Even if that means that we're not going to finish the donation and someone's not going to get your blood, which can save their life, right? And so if I can't even be forced to be made uncomfortable to save someone else's life, how can anyone force someone to put their life on the line and permanent health repercussions to save someone else's life? If you can't force uncomfortableness, you shouldn't be able to enforce this far, far, far greater danger, right? Um, Again, I don't think that Jack is one of these people, but I do think a lot of people who just give that argument have very little appreciation for what pregnancy can entails and what it can do to someone's body, right? Um, and just I don't I have to think more about holding someone criminally negligent. I see why Jack thinks that. I'm not sure I can get on board with making this like a legal thing or something that can be codified into law. But I mean, for me, the issue is essentially, yeah, can you, I mean, if you outlaw abortion, you might as well be strapping a woman down and forcing her to be pregnant functionally, right? Especially one that has elevated health risks. And I just cannot get on board with that. I cannot get on board with having any law that says that we can do that for one human being to another human being. Do I think that maybe that human being should take it upon themselves voluntarily and that it says something about their character if they don't? Maybe, depending on the circumstances. If the reason if the reason Shimp didn't want to do the bone marrow transplant is just because he didn't want to be uncomfortable, yeah, that says an awful lot about his character. If the reason Shimp didn't want to give bone marrow is because he thought it would give him, a permanent uh, repercussions in life, both health and socially, and he didn't want to take that chance, I think that doesn't make him as bad of a person, right? And so I'm willing to get on board that it might say something about your moral character. I think that's situation specific. We could talk about that. But I cannot get on board that it could be legally enforced. And if I can't get on board with it with bone marrow and blood donation or maybe like kidney donation, if someone needs my spare kidney, if I can't get on board with that, I can't see how I can consistently get on board with that when it comes to abortion. And to push it even further, let's briefly talk about organ donation, right? Organ people, millions of people die every year, millions, because there's a shortage of organ donation, right? Millions die. But still, we can't even take organs from a corpse that said not to do it. So if I left behind, I don't want to I want to die with I want to be buried with all my organs, even if my organs can save 5 or 6 people, even in death, that's respected. So I cannot wrap my mind around how we can respect the wishes of a corpse or a dead person more than a live woman. And so that's what I'll stop for now.
Yeah, thanks, Bertha. So I guess now is when we have a little bit by way of back and forth response and that kind of thing.
Yeah.
Just a couple of things just to kind of get us moving on that front. Let's see. Yeah, so I think those are all really important considerations. And like I said, I mean, and I'm grateful to Bertha for pointing out, yeah, I mean that pregnancy is just a really surpassingly unique state. Obviously, I've never experienced it, right? It's not there are lots of things that really difficult to say, but it definitely is one in which you assume a certain number of risks, right? And so it's really difficult to talk about, right? Because yeah, I mean it's just a surpassingly unique state. But I mean that doesn't mean we can't talk about it. Doesn't mean we shouldn't talk about it. It just means we need to be careful, right? So Bertha's making some parallels here, right, to kind of organ donation cases, right? And I mean I think we can put honest. I mean, so yeah, I mean, we definitely agree that it's complicated to talk about organ donation, bone marrow donation, these kinds of things. And I think we need to put these things on a kind of spectrum, right? I mean, like, blood donation, right? Relatively non-invasive. Bone marrow extraction, relatively more invasive, right? Obviously when you start talking about organ donation, you're talking about, depending on the organ or depending on, certain kinds of things, you could be talking about a very high risk kind of thing. And, that just needs to be taken into account, So on the one hand, just because I think that the law could regard Schimp's abstention from offering his bone marrow when he's the very unique donor who can, save his cousin's life or whatever, right? And I think the law could regard that as criminally callous in certain ways. That doesn't mean that I think that we just need to apply that verdict to every organ donation case, right? Because, I mean, you start to assume greater and greater risks, right? And we need to take that into account, right? We also need to take into account the fact that, certain people are going to be at higher risk, right? And we need to allow that to be a factor too. I mean, the judge might have allowed Schimp to be, sort of less culpable, or maybe the judge could have said, well, look, Schimp is just the wrong case for this because Schimp's constitution is such that Schimp would be a bad fit for donating bone marrow, right? Because Schimp is imperiled in certain ways by doing that, right? And again, right, I mean, if you've yeah, so there's a lot of factors there. But fundamentally, all right, what I do want to say about this case is that I still think that abortion is a disanalogy with all these cases at some point, right? There's some inspiration we can draw, from these cases for the abortion debate, but fundamentally, I still think that there really is a real disanalogy because, abortion, in the way I would define it, right, is an act that, right, by its very nature, puts the fetus in grave peril, right, and is a sort of discrete, intervention that puts the fetus, by reason of the act itself, in that grave peril, right? And so I think that, when like, I think abortion is a sort of particular act, right, that puts one person, right, directly in harm. Whereas, right, in the Schimp case, we've still got a case where someone is in a kind of ongoing state of harm, and the question is whether someone's going to take a positive step to help that person, as opposed to taking a negative step to end that person's life. And I do think that distinction is relevant, right? There's a sort of positive intervention in the case of, most abortions, right? Like if we took, well, it's hard to talk about most abortions, but let's talk about like a suction curettage or something like that, where it's sort of a kind of could be a fairly midterm, right, intervention, right? And in a case like that, I think that case would be a particular intervention that is a discrete intervention, and that is a sort of an act against the fetus, right? Yeah, and I think that's different than refraining from offering someone positive help, right? So that's the one thing that's one thing I would say there's a relevant distinction there. So, yeah, and I mean, I know Bertha's going to have some things to say in response to that, so I think maybe I'll just let her go ahead, right? Oh, can you not hear us? Or can you? Oh, heaven's sakes. Do you know why she might be muted?
There, I'm done. There.
Okay, back. Okay, great.
So Thompson makes this distinction that she says that um, the right to an abortion is a right to refuse to continue to give aid to another human being to continue their life. But she has this little caveat at the end that I don't think a lot of people read, and which I think is more important than people read into it. And she said, but if it were possible to detach the child alive, where it no longer needed the woman's body, then you don't have a right to turn around and demand the death of the child, right? So that the right to abortion is a right for you to say, I no longer want to continue giving aid to this other human being. It is not a right to directly kill the fetus if it were possible that when it just didn't need your body anymore. I think that's right, and I actually think that makes a really good case for why viability is a really good cutoff point for for most cases. We can talk about some exceptions to that. And so I actually think that that's right. So like with McFall versus Shimp can very well say, yeah, I'm not going to do the bone marrow thing even if he dies. And then by some miracle, um, McFall, finds another bone marrow or makes it or whatever, and he survives. Yeah, Shimp does not have a right to turn around and shoot him in the head and then say, well, he was going to die anyway because I wasn't going to give him the bone marrow, right? Um, so in that sense, I actually do kind of agree with Jack that there is a distinction between like taking a positive step to end someone's life, um, especially when they don't need your aid, right? So if the right to an abortion is a subset to a right of a bodily autonomy, what your right is, you do not have to give aid to another being to save its life. That's it. You don't have a right to anything else. And so so like there are people who have made arguments that should, if a baby survives an abortion, should they get resuscitation and get aid? And I think it's completely horrible that some people argue that no. I think it's clear to me, absolutely, right? Absolutely, if a baby survives abortion, it needs to be given all the aid that is appropriate to give it. Um, because I think that her right to that baby's uh, decision about its life ends when her bodily autonomy ends. She has no additional right to demand the death of this child. There's actually some people who disagree with that. I've gotten in trouble with those people who are very, 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 who are more extreme pro-choice than I am, and will say that, well, the mother should decide in the end whether or not she wants to be a mother, wants the baby to live. I think that's absolutely false. And not only do I think it's false, I think it's kind of appalling to make that argument. So to some extent, I do agree with Jack about positive versus negative rights. When it comes to abortion, the reason I'm not convinced that that distinction applies as much is because, well, here's a test, right? If I went to a pro-life person who's given me a similar argument, and I say, okay, fine, let's make this as analogous to um, not passive acting as possible. We're not going to destroy the embryo or the fetus's body. We're going to open up the woman. We're going to take it out, and we're just going to leave it on a pan. Right? We're not going to do anything. We're not going to kill it. We're just going to let it die. I don't think many pro-life people will be like, oh, well, that's okay. No, right? Because there's a distinction between both action, and they'll say things like, well, both actions are leading to the fetus's death. I'm like, right, that's right. Both actions are leading to the fetus's death, so it shouldn't matter whether it's through passive or active means. They're both, leading to the fetus's death. And so I think it's the same thing here, right? I just don't see how this is not just another instance of refusing to continue to give aid to someone to save their life. Um, and again, to go back to the bone marrow example, I could be like in the middle of a bone marrow transplant. I could be towards the end of a bone marrow transplant. They could be telling me something like, you only have 5 minutes left. And I could still say, yeah, I'm done, stop. And they're like, oh, but the person's, he will die. You're like, yeah, but done. And they're like, but it's 5 minutes. I'm like, I don't care. Stop it. They have to stop it, right? They have to stop. And again, and if you could justify that for like being uncomfortable for 5 more minutes, if that's enough justification to stop a transplant that's going to save someone's life, I think ending a pregnancy because it has all these health and social repercussions is at least as good of a reason, if not a better reason. Right. So that's my immediate response to that point.
Sure. Thanks. Yeah, and I mean, maybe we've still got some time, so maybe we just kind of bat this one around for a little bit longer,
Yeah.
unless anybody has any objections. But yeah, I mean, you might notice that Bertha and I are sort of like, on the one hand, we agree about some things. On the other hand, we're also kind of being consistent at various points, right? Because she's like, well, I still think it's sort of like giving aid or not giving aid, and I'm kind of conceding that at certain points it is like giving aid, and you should, right? At certain points, right? That doesn't mean that every case is identical. It doesn't mean that every kind of case of donating or from blood to bone marrow to organs, right? There's all kinds of relevant factors that differentiate the cases, but and it's important too, as Bertha recognizes, that I mean, in the literature, there's a distinction between what we can sometimes call abortion as evacuation, right, and abortion as feticide, right? Whereas, like, if abortion were simply, right, evacuating the fetus, right, from the woman's uterus, then that's an interesting thing, right? Because once you evacuate a fetus from a woman's uterus, then you can talk about, okay, do you have that right to do anything else, to intervene to end the life of the fetus? And there are people that think that you do have that right, as Bertha recognizes, and helpfully for our conversation here, right? We agree that wouldn't be a good thing, right? But there definitely are people out there that would argue that. One other thing, though, I mean, right. So let's take, a fetus, right, that either isn't viable, right, or is still kind of in that zone, where viability may be theoretically possible, right? I mean, the thing about viability is it's a moving target, right?
Yeah.
Viability, by the way, is if you don't know this term, viability is when a fetus or an embryo can survive outside the womb, right? Were it removed, right? Pardon me, a fetus, because no embryos can survive. But what's interesting about Bertha's case there is that, especially if you take a sufficiently late term, fetus, or sufficiently late term, we'll just go with fetus now. If you go sufficiently late term fetus, I mean, you could talk about that as a simple matter of inducing pregnancy, as sort of induction. I mean, if it's very late, right? If it starts to get closer and closer down here, then inducing pregnancy too early results in a threat to the life of, the fetus, right?
I think you mean birth, right? Inducing birth.
Yeah. So birth, right? I mean,
Right.
like if sorry, I don't. Yeah. Right. Yeah. Right. Yeah. So I mean, if the fetus is born too early, then you've got real complications, and there's a risk, that you've introduced into the fetus's life, right? Obviously, if you eject the fetus, right, from the womb, right, prior to viability, I mean, there's a case where you're essentially, putting the fetus in a situation where it can't breathe, right? Where it can't stay alive, right? What the analogy there is not just removing, something that would otherwise depend on you. The analogy there, well, I don't want to be too callous here, but I mean, look, I mean, if you directly introduce, right, if you directly take a human being, right, out of a situation where it has the assistance it needs to survive and introduce it into an environment that is toxic for it, right, then that's a direct intervention. That's a real problem, right? And you know, I don't want to make light of that situation. I don't want to suggest that it's any less complicated than it is, right? But it seems to me that there are relevant parallels where, right? Well, I don't know. I don't want to go too far with the parallels, but I'm nervous about the idea that you could introduce you know, the fetus into a situation where essentially it doesn't have what it needs to survive. I mean, how different is it then from going from air to water, right? How different is it from, you know, you having the air you need to breathe and sustain your life to going into a situation where you're now in water and you're drowning, right? That's a discrete intervention, right? And then the question becomes, yeah, but the fetus was still and utterly reliant upon, right, you know, the mother for this life-sustaining intervention, this life-sustaining aid, right? And then we just need to have that hard conversation about, right, but pregnancy is just such a unique state. And there's nothing like it. And that's the situation we're in, where, you know, you can either do something really important and heroic to give someone the life-sustaining aid they need to exist, or you can positively intervene in a way that will end that person's life. It's not like those are the two options there at that point, right? It's not like you can choose to be a kind of good person. You can choose to be a hero, or you can choose to be someone who made a bad choice, right? And that's that. Sometimes life is like that, right? That doesn't mean that I'm saying that everyone's culpable in the same way, or that everyone is suddenly a villain, right, who undertakes an abortion. I realize those are complicated decisions, right? And it doesn't mean that you know, people in desperate situations are not simply bad people because of that. Of course not, right? But it's a really unique situation, and it's not a case. You know, the two options are: be a hero or make a bad choice, it seems to me. So yeah,
So there's two things that I wanted to bring up. Is that I think the issue for me is that, can you compel heroism, right? Can you legally make a law that forces someone to be heroic? And I have problems with that. Right? If the choice is heroism or making a bad choice, I'm not sure that dichotomy works, and I'll explain that afterwards. But if those are the choices, the issue that we're talking about here is, okay, can you compel heroism? And I don't think anybody would get on. I don't know. I find a hard time thinking people can get on board with that, right? Can the government come in and legally compel you to be a hero? Insofar as that, are you making a bad decision? I think actually that this is a layer of the abortion issue that doesn't get talked about enough, probably because it's so fraught and complicated. But if you listen to people who will say why they don't agree with abortion, typically the reasons that they bring up are reasons having to do with the woman's motivation, right? I don't think we should use abortion as birth control. I'm not sure what that mean. I know what they mean by that. I'm not sure that necessarily happens. At least it doesn't happen as much as people think it does, because abortions are very, very expensive and very, very invasive. So I'm not sure there's an epidemic of people choosing abortions over condoms, but But well, people will say things like, well, I don't think you should use abortion as birth control, or I don't think you should use abortion out of convenience, or I don't think you should use abortion because you just don't want to take responsibility, right? Those are all your issue you're taking there are the reasons people are choosing abortion. They're not necessarily the abortion itself, right? Because the same people would probably, and we could talk about this at all, it goes, no, but rape is different, right? That's a different thing. And that shows that they're willing to make exceptions. And the reasons they're willing to make exceptions is because they think rape is for the lack of better, a good enough reason to have an abortion. Now, not everybody thinks that. I know Jack doesn't. And again, that's the consistent route. So I don't, for consistency, I don't have a problem with that. But most people do make those exceptions. And that shows to me that what they're morally judging are the woman's reasons for having the abortion, not necessarily the abortion itself. And we could talk about that, right? We could talk about what makes a good reason from a bad reason, or an acceptable reason from a non-acceptable reason, right? I think that's a really good conversation to have. I think it's a very difficult and complex conversation to have. I don't necessarily mean that doesn't mean that we can't have it, but because it's so complicated and so multi-layered, I don't think it can be adjudicated, right? I don't think we can have a law that says, for these reasons are abortion okay, but not for these reasons, right? Because that's going to make a simplistic, that's making a simplistic judgment on something that is very much not simplistic, right? Then we get into things like, well, what about a woman who, is in an abusive situation and is afraid that if she tells her partner she's pregnant, he's gonna, kick her in the stomach and kill her, or when the baby's born, he's gonna, bring them both out and look for them to kill them. Is that a good enough reason? Are you gonna go to court and a judge is gonna decide? Yeah, that's okay, or no, it's not, right? You can't adjudicate those things. You can't make those things legal or not. And so my concern is, in the end, can you criminalize abortions, or is there something that should be allowed? And for me, that action is the act something that should be allowed? I think for the reasons I have, it should, up to a point. And I do think we can have the conversation about what constitutes a good reason versus a bad reason to have an abortion. I think that's a very worthwhile conversation to have. I've tried to make that conversation in one of my books, but I don't think it's a conversation that you could have at a political, legal, governmental level, right? So that's my immediate response to that.
Great, thanks. One last thing, and then maybe we can move on to, or well, anyway, I'll say one thing, and then if you want to have the last word, you're welcome to.
No, it's fine.
But the two things that I might just say by way of quick response. I think we actually agree that there aren't good reasons to have abortions.
I agree that I totally agree that there are
Well,
bad reasons for having abortions.
Yeah. So no, but I think that I think insofar as you seem to suggest that the law isn't the right arbiter for what the
Right.
good reasons are. I too think that the law isn't the right arbiter for what the good reasons are. I just don't think that the law should think there are any good reasons.
I
Right?
see.
Yeah. So anyway, the last thing then is your interesting question. And again, this is another one of those nice places where I think we can kind of see where we part ways is can you compel heroism? And I mean, strictly speaking, probably not in some ways, but we do. I mean, it's a long tradition within many societies to have military conscription, and lots of pro-life writers have made, not exact, but still, relevant parallels to the idea that the state asks certain things upon its citizens, right? Like military conscription and things like that. We tend to think that that's something we'd like to do without, right? In kind of the post-war era, but there are still plenty of countries that do that, right? And yeah, so I mean, at certain points, right, maybe there are certain things that the state can ask people to do. The other thing, though, is well, anyway, I'm going to stop with that because we could go on and on forever. Yeah. So should we just we should take some questions maybe? Is that okay?
Yeah, whatever you want.
Okay, so Mark's got the mic.
Back and forth.
I found your reference, both of your reference to the is it the Shem? Is that how or
Yeah.
yes, the case very, very interesting. And Bertha, I really appreciated your touching on this matter of compelling heroism. I'm wondering if there's an a priori question, which would be, what is the proper role of government? To what degree does government have the right, the legal right, to legislate any number of things, particularly in the moral arena? So that would be my question for both of you.
You want to take?
Yeah, this is a really good question.
Mhm.
Because I don't know, man. I'm trying to think of things that I want to say that they should get involved in. I'm having a hard time thinking of something right now. I mean, murder is morally wrong, but that's not necessarily why it's compelled, but I don't know. I have to think about positive cases of compelling morality, but I can think of many immoral things that the government shouldn't get involved in, right? I think adultery is immoral. I don't necessarily think the government should get involved in, what your sexual life is and what your sexual choices are. Um, I think that you could make a case that if all you have to do is sit through 5 minutes of a bone marrow transplant to save someone's life and you don't do it, yeah, that's a pretty crappy thing to do, and it doesn't say much about you as a person. Can I think the government adjudicate that? Probably not, right? So my immediate intuition would be to say there are some moral things the government can have their hands in. I'm having a hard time thinking of one right now. But I can definitely think of many immoral things the government should not be involved in. So yeah.
I made a note about this in my notes for today, and so there's a place in our book where I just grabbed a few of them, and so I say something like, all you need to do to consider to think about this is to consider whether the state should take action concerning matters as diverse as seatbelts, motorcycle helmets, prescription drugs, illicit drugs, military conscription, blackmail, noise levels, dwarf tossing, minimum wage, state-sanctioned health insurance, contempt of court for witnesses refused to testify, gun control, blood donation for able-bodied citizens, the dissemination and consumption of pornography and prostitution. I mean, those are just some of things that we legislate and regulate in various ways, right? Well, right. And so the question is, should we, right? And should we have some regulation of them? And I think, yeah, we should have some regulation of some of those things. Do I think that what we do at this moment is what we should do exactly in all those cases? No, but should we have some governmental regulation? Sure, yeah, some.
And to bring this back to abortion, I'm not in the camp that we should have absolutely no regulations for abortion and abortion should be legal up until the second the baby's born. I actually don't think like that, right? So I do think that some regulation on abortion is justifiable in certain situations. But so I'm not against regulating abortions to some extent. So I still think I could agree that something should be regulated, but still hold the case that most, at least up until a certain point, abortion should be permissible.
Yeah, I was thinking this sort of plays into this whole question. I don't really get the whole concept of viability because I think I believe, and I believe everybody here in this room might agree with me, that a 1-year-old baby is not viable. If you leave a 1-year-old baby by itself in its crib, it will soon die. And we would say that if a mother knowingly and capably withheld feeding that baby or taking care of that baby, she is criminally liable for that. Would we not agree with that? So that's my dilemma is, okay, if something is illegal to do the moment after they're born, it goes way back before that in this young man's opinion.
Anything you want to say about that, Bertha? Or you...
I think what I want to say immediately is that this goes back to how I began, that, understanding the gravity that is a pregnancy. Yeah, you should feed the baby. It's not hard to do. It's not going to kill you. And you have an obligation to it because you have taken it home and you have assumed obligation over it. So yeah, feed the baby, of course. And if you don't do it, you're negligible, you're liable. Now, if your baby needed, I mean, it doesn't really work that way because you can't put adult organs in little babies, but grant me for a second that you can. If your baby needed a kidney and it's your kidney, should you give it to him? There's two senses of the word should. Morally, absolutely. I can't even imagine. I would take it out myself before the sentence was even finished to give it to my kids. Can you force it? Can you make it illegal to not do it? That's where I think it gets dangerous, right? So I think, the difference between, feeding and pregnancy is that pregnancy has a lot more at stake for someone's physical and mental health than giving a baby a bottle or a breast. And again, those are hard to adjudicate as well. At what point is it, is it too much of an infraction, so on and so forth. But I think that's a relevant distinction that should be discussed more.
In the law, there is no duty to rescue. That's the beginning place, unless there is some duty that has been assumed or developed somewhere else. So you don't have to, when you talk about that, if somebody doesn't do that, they ought to be criminally, no. I could be standing on a corner and there's a blind man right here and it's very quiet. We don't hear anything, but I see that he's about to step out in front of that bus. Too bad. No liability. No duty to rescue, because it's darn near impossible to sort it out, how far it reaches. Anyway, so that's a thought.
I wanted to come back to the discussion earlier about, this idea of sort of removing a fetus before viability. There are plenty of pregnancies that end in extremely premature births. And when those occur and all those babies are in the NICU, parents have choices about what types of interventions they feel is appropriate for their child. Many of those interventions, research has shown can be painful, uncomfortable, can result in lasting disabilities. And parents and physicians often, or they certainly should, be having discussions about how far to take an intervention to make sure that a newly born baby now is viable. Mm-hmm. So are we suggesting, Jack, with your argument that parents should be compelled to accept every intervention that's available in order to allow that child to live? Or if the answer is no, if a parent can make a decision with their physician to not implement an intervention, knowing that that child may die, what's the difference in that decision making?
Right.
Just because the baby is present in front of us right now.
Right. It's a great question. And I mean, that one seems like it's more in my court, but if you want to take a turn at it, by all means, Bertha. But yeah, I mean, I think the relevant parallel here is to kind of end of life cases too, right? Because end of life cases are ones where we talk about you know, we talk in the discussion of end of life cases, it's pretty common to invoke a distinction like ordinary versus extraordinary measures, right? Now that's a difficult distinction, and it's sort of vexed in various ways, right? It's difficult to know, right? You know, what people are going to say there, right? You know, for my part, and you know, this is something that Catholic Church has various you know, claims that it makes about what constitutes ordinary and extraordinary things in end of life cases. For the most part, right, you know, like end of life cases are cases where, right, you could, especially where you're dealing with like imminent death or something like that, right? You could refrain from particularly extraordinary measures, right? That might be surgical or might be disproportionate with regard to the kind of, you know, length of life they're likely to secure, right? You know, and various things, right? When someone's already in kind of case of impending death. But it's usually taken to be ordinary means or ordinary measures to supply person with food, right? And those kinds of things, including by way of a feeding tube and things like that. Now, of course, not everybody agrees about that, and I understand that, but yeah, that's a distinction that's commonly made. Yeah, it strikes me that we would probably invoke a similar kind of distinction here when we're dealing with you know, a baby, since now we would probably call it a baby since it's no longer in the uterus, right? We're dealing with a child, right? You know, maybe a premature childbirth, certainly, but yeah. So then we have those hard conversations and questions about what measures do we think are the right ones here? What measures are so extreme as to, you know, I don't know. On the other hand, you know, I think fittingly, we probably think that there are more things we're probably likely to call in bounds, right? When we think about, you know, securing a longer life for a child as opposed to a shorter life for, you know, an adult who's very near death, right? But that doesn't mean that there's nothing we could rule out as being extraordinary. And so yeah, I mean it's complicated, and I'm not here to give you a rubric or anything like that. But does it mean that zero things could count as so extraordinary that we could never have we absolutely must have recourse to everything on offer? Yeah, I don't know that that's what you need to do. But it would be, presumably it would be a situation where you would probably be more likely to avail yourself of more options in the case of an infant than you would in the case of someone where death is, say, imminent.
I'd like to suggest that given the quality of comments that we're getting from the audience, we have an audience here that has chosen to come the second time, was stimulated enough, and has heard a wonderful explanation of both of your points of view. I think what we're hungry for is more discussion in the sense that when a person makes a comment, you say, good point, and go on to the next person so that a point that someone made can just be up there in the air for us to take home and think about. It's part of the whole subject that we're discussing, and that the presenters do not need to make a specific answer to each comment that's made by a person. It's kind of like, is this a debate or is it a discussion? And it needs a little more discussion time. So can I suggest that sometimes just say good point, and you'll see that I think the people will bounce off of each other. When you say something about a point you made, and the next speaker will say, coming from that point, we're all used to doing that, of bouncing off of each other or going to another point that was stimulating. So could we give the next 20 minutes to really true discussion of the audience, of the things that we've heard? That's very, very worthwhile. Okay, thank you.
I agree with you, and I'm going where I'm from. Part of my questions, and it's going to come from a background, so I need a few minutes, not a few minutes, but at least just 90 seconds to say something. But I grew up in suburban Chicago, and I met my dad at the train and walked home with my dog, and I read the Chicago Daily News, Jack Mabley. At age 9, I asked my mom what prostitution was, because Jack was talking about in the column, so I was curious. I've seen at least two abortions in high school, obviously done by the backyard butchers or whatever you want to call them. The women lived, but so this is going on. And then when I was 17, I worked at Sleepers Rexall Pharmacy in Bellwood, Illinois, and Harold from Harold's Tap across the tracks came in. They ran the numbers game there. I think you probably could get girls there. It was somewhat illicit. So where do we control this? And then on the other hand, I see groups, and maybe I don't want to offend anybody, but there are groups like, say, Focus on the Family out in Colorado that's concerned about a woman getting an abortion in Sault Ste. Marie. And I'm saying, well, the woman in Sault Ste. Marie is talking to her pastor or doctor. What's the other group involved? This is where the law gets confusing. And I think Mabley back in the 50s said it was confusing. What is your thought on abortion as far as the law and if you don't do it, it doesn't stop it?
The legality is not just
I guess so help maybe if you want us to engage with the question, okay. Could you help me understand the question a little bit more, right? So you know, you talked a little bit about various things that you've seen and so forth, right? And you know,
so the question is basically, just because you say I've just passed a law against abortion, it's not stopping. The backyard places are there. You pass a law against liquor, it's not stopping. Prohibition, we saw that. You say there's going to be no prostitution. I don't know, because I'm faithful to my wife, where the prostitutes are in Holland, but they are, I'm sure, here. So we can't just deny because that. And then you have the question too of a secondary question of an out-of-state group that says, hey, this is what we think it should be. And that may be fine. If that's what the state wants, that's fine too. But how do we get this into a controlled situation to minimize the damage, to minimize abortions? I'm not in favor of recreational abortions. I'm saying minimize them. But we can't just say, well, a good law is going to stop it, because we know that's not going to occur.
Right. I think we wrote a chapter or so on that, Bertha. I mean, if you all want to talk amongst yourselves, that's fine. But if, oh yeah, okay. Well, the first thing I'd say is that I don't think it's the job of law to solve the problem of abortion. Right. I don't think you look to law to make abortions go away. Of course not. Right. You know, I just don't think that's what they're for. Right. But I mean, a law, I think, is there to tell us what the society thinks is just. As far as what we might do to create a culture in which there are fewer abortions, that's a secondary concern, but it might, I mean, I think we need to do a lot of things, right? We need a better social safety net. We need, you know, a better respect for the act of sex, right? You know, we need those kinds of things. And Bertha and I are going to disagree about some of those things, but Bertha, do you want to chime in on that at all, or no?
I mean, does the speaker want me to, or? Yeah. So do I do it? Okay.
We'd like to hear from you.
Oh, okay, thank you. Well, I kind of mentioned that last week, right? Where I said that another reason that I'm against abortion laws is that they don't work. And as you said, they don't get you to what you want, which is to, stop or minimize abortions. And to the extent that, and then what they do give you is a lot of women having illegal abortions, a lot of women dying. Like I said, we could talk about what's going on in Texas and Georgia of women who have almost died because the hospital wouldn't touch them because of their abortion laws. Um, they don't really work to save fetuses, and they really harm women. So they don't work. But I'm with Jack that uh, we need to look at what does work, and a lot of what has the data shows does work are things that politicians who are pro-life consistently vote against, which I think is baffling to me. Um, but at the same time, like on a purely philosophical level, right? Not necessarily on like a utilitarian, what's actually working in society level. That argument can be problematic, right? The argument being that, well, we don't need to legislate X because X is going to happen anyway. Uh, that would leave very, 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 very little left to legislation, right? We shouldn't have speeding laws because people are going to speed anyway, or we're not going to have murder laws because people are going to murder anyway. So I hear, I hear that a lot with like gun control that Jack brought up, which is like, well, we shouldn't regulate guns because the criminals are just going to get them. I'm like, oh, well, that's great. That's what they do. They're criminals, right? So by that logic, we should have no laws because the criminals are going to violate them. So um I think that there's a really practical, good discussion to have on how abortion laws function in reality. Um, but I think that argument by itself that people are going to do it anyway, so we don't need to legislate it, or we shouldn't legislate it, doesn't always hold up.
Um, I think that we are talking about extremes in this case. And I want to talk about what it's like to be 18 years old or 20 or 21 and on an uncomfortable date, getting pregnant. And my concern, the way that the government is rolling right now is so far away from women's rights. And this issue for me is a woman's right issue. And we're far enough along in our biological sciences to have, we now have a pill that will stop an abortion. Beg your pardon? Stop the pregnancy, rather on say, thank you. I don't think that in this day and age, you're talking about such extremes here is driving me nuts. I want to know why you don't understand that as a woman, I have a right, whether I want to carry a pregnancy to a full term. And I don't think anyone should take that right away from me.
I would say in response to that half of the people that are aborted are women. And so, I mean, that's a woman's right too. I think it's also a man's right not to be terminated.
Go back to the notion of when can you terminate aid? So you're standing on a bridge. Okay, you're standing there looking out. Oh, pretty river down there. Okay. And some young man comes running by and says, quick, hold on to this rope. And you grab it and he jumps over. How long do you have to hold on to that rope? When can you just continue? You started, you took a hold of it, you jumped.
This is a very complicated issue, and we're certainly seeing that. What I'm interested in, though, because you've modeled this, I think, really quite well, is at what point in time in your conversations with each other, and what led you to say, we can disagree pretty strongly about this matter, but we're going to remain in touch with and continue to dialogue with each other. How did that happen?
I think, again, for me is, that there was a close pre-existing friendship that I wasn't willing to give up. And an assumption of virtuous character that I know that where he's coming from. He's not cruel about it. He's not callous about it. He's not dismissive about it. And I respect that greatly. So I wasn't willing to let go of the friendship, and I know his motives are kind and pure, and that makes me want to continue talking to him about it. And I know he's not going to judge me as like a murderer either.
Yeah, it's the same thing. I mean, I think we were saying this last time, it's just about, when you have a pre-existing relationship with someone and you already care about that person, I mean, there are certain times in the discussion where you just have to say, okay, well, I could blow up and try to do something foolhardy, right? Or I could just realize that we could continue talking, right? And we could just continue having friendship, and yeah. So.
And there's also lots of stuff we do agree on too, which I think we don't in the debate. We don't. I'm sorry, I lost my train of thought. But there are things that we agree about that are relevant to this debate, which I think also helps the dialogue.
Yeah, it's interesting that, I mean, I'll be quick about this, but in the abortion debate and in the literature, Bertha is not the most extreme pro-choice person, and I'm not the most extreme pro-life person, right? There's some kind of way to find our way toward a little bit of the middle too. So
This isn't a question or anything. I recently read a book called You're Wrong, but I'm Listening. And I read the whole thing. It was for people who care about each other, family members and others, how to talk about political issues without killing each other. And I thought, how does that work? I see how that works. And I thought, well, you have to go out and do your own research, and you have to bring back the points. Oh yeah, I agree with that too. Well, I don't. Thank you. You have modeled that very well. And I wish I could tell you who wrote it, but I can't remember.
Yeah, I think I'm willing, especially with our current political climate, there are lots of things I'm willing to talk about. Where I lose my patience is like abject, like cruelty or abject loss of empathy, right? Like I am absolutely willing to have a conversation about what would be the best way to reform our healthcare system, right? I don't have patience for conversation about, do people deserve to die because they can't afford healthcare? That's where I lose my ability to have a conversation, when I feel like you're saying something so horribly disgusting that I cannot continue, right? And so I think that's, a difference too.
Jack, I think I heard you mention, as we have talked about this, that, there are other ways that we can help women, and possibly prevent the need for an abortion. And yet I am finding in today's government, they are being taken away. And that is Planned Parenthood, which is primarily about education. and helping people understand. And then we go from what can help a woman who hopefully prevent her from becoming pregnant and having an unwanted pregnancy. But let's say she does and she delivers the baby, then we have taken away all of the social programs that help them. So there are things that I think need to be talked about more and things that need to be done. And yet we watch as things that are important in a community where people care about people are being taken away and decided primarily by men. So.
I also don't want to go talk about just the extremes because I respect the point that was made earlier, but I just want to make the comment. I was thinking about the exchange that just occurred about why the two of you are able to continue this discussion. And Bertha, you talked about Jack's empathy and caring and such, but I just have to honestly say that when I hear somebody say that there aren't any appropriate or permissible reasons that an abortion should occur. And I think about the extremes even. I think about an 11-year-old that was raped by her father and is now carrying a pregnancy. If that's not a permissible reason for ending a pregnancy, then there's no permissible reason for doing so. And that to me is cruel and lacks empathy. So I respect the two of you for that dialogue, as was mentioned earlier, but that's hard for me. I have to just honestly say.
Jack and Bertha, I think I speak for the whole group. Thank you very much. We appreciated the dialogue.
Thank you.
Mhm.
Thank you for coming too.
Did you say something, Bertha?
Yeah, I said thank you for coming.
Yeah. Thanks, everyone. Thanks for coming.